in today's video in today's video today we are going to discuss about anatomy. This is introduction video. Anatomy. Ana means to see, tomy means to cut. What we should see and what we should cut. When a body is placed like this and we will dissect the body, and if we dissect the body, and which means if we cut the body, we see layers. The first layer we are going to see is skin. Second layer is known as superficial fascia. Third is deep fascia. Fourth is muscles. Fifth is bone. In any part of the body, we are going to see these structures. And then, why anatomy is important for us to learn. Anatomy is basic concept in basic subject in medical school, and it is important to learn all the structures of the body, the location of the body. That's why anatomy is important. And how we are going to study anatomy? As I said, to know the locations of each part of the body, we study anatomy. That's why it is important. And how are we going to study this? We are going to study by imagination, by imagining something. And what are we going to imagine? Imagining yourself that you are here and we are going to study anatomy like this only. We will imagine ourselves and we are going to study the boundaries of the structures, roof, floor, content. Imagining ourselves here, our roof contains skin, superficial fascia, deep fascia, and our floor contains, this is roof, this is floor, and our floor contains muscles and bones. And where we are sitting in that room, it contains what it contains is vein, artery, nerve. For almost every fossa, triangle, compartment, for every triangle fossa, these are the roof contents, these are floor contents, these are content. These structures remains the same. And coming to this, vein, artery, nerve. Every compartment, every triangle, every fossa contain these three. And how these stay in between deep fascia and muscle. They are going to form a protective covering known as neurovascular bundle. Neuro means nerve, vascular. The name suggests something about vessels, blood vessels. Vein, artery, neurovascular bundle. It covers vein, artery and nerve. Vein, artery, nerve. Nerve does not have lumen. Both vein and artery have lumen, but vein is thin-walled lumen, artery is thick-walled. And also vein is thin-walled and it can easily collapse. Artery is thick-walled and can recoil. Nerve does not have lumen and is solid cord-like. And this is about basic subject about how we are going to study anatomy. And now we are going to know about terminology that is used in anatomy. Terminology. Terminology. We are going to learn about position, planes, position. We have anatomical position, supine, prone, lithotomy and lateral decubitus position. This is the body. Head, neck, shoulder, hand, palm facing us, leg, palms facing us. Imagine this body is sleeping on the floor, and if the palms facing sky, this is known as anatomical position. The body is lying on the ground and palms facing sky, known as anatomical position. Supine position. Supine is sleeping on bed, that is known as supine position. And prone position. Prone position is when you sleep on backwards, which means prone position is used when the patient is having spinal surgeries. Sleeping on chest is known as prone position. And lithotomy position. Lithotomy position is when patient is lifting both her legs and sleeping like this, exposing perineum part. It is known as lithotomy position. It is used in OBGY examinations. And lateral decubitus position is when patient is sleeping on sidewards, exposing ear. It is used in ear surgeries, exposing one ear, sleeping on sidewards. Like when we don't have space, we will tilt to one side. Like that, if the patient sleeps in that position, it is known as lateral decubitus position. Planes. Now we are going to study about planes. Planes are used in radiology, surgery, OVG, and we have four planes. Those are coronal, sagittal, transverse, mid sagittal. Now, first we are going to study about sagittal. Sagittal is when we cut the person like this. Vertical cutting is known as sagittal plane. Mid sagittal is when we cut into two equal halves like this. This is sagittal. This is mid sagittal. Any plane which divides the body into two equal right and left halves, it is known as mid sagittal plane. Any plane which divides the body into right and left halves is known as sagittal plane. And now we are going to study about transverse plane. Horizontal section is known as transverse plane. And coronal plane. Coronal plane is when it divides the body into frontal and ventral halves. Is if this is the head, if this is known as coronal plane. It divides the body into front and back halves like this. It's known as coronal plane. And oblique plane. Oblique plane, any plane which is making angle with ground is known as oblique plane. It's like cutting the body diagonally. Any plane which is making angle with ground is known as oblique plane. And with this we have completed positions, planes. And now we are going to learn about terminology. Terminology. And what are the terms we need to learn to study anatomy? First one is superior inferior. Next one is cranial caudal. Cranial caudal. And next one is anterior or posterior, ventral and dorsal. Anterior and posterior. Superior, the name suggests something above. Inferior, the name suggests something below. And now, for example, superior means the structures which are near to head. They are superior. For example, uh, heart is superior to urinary bladder. Inferior. Urinary bladder is inferior to heart. Cranial and caudal, which is also the same. Cranial means which is superior to, is similar to superior, which is something Near to head is cranial. Caudal means near to foot. It is mainly used in embryology. Superior means above, inferior means below. Simply, cranial caudal is used in embryology. Cranial means something near to head, caudal means something near to foot. And anterior and posterior. Anterior means something in front, something which is in front. Posterior means something which is in back. Dorsal and ventral. Ventral means something in front. Dorsal means something in back. For example, kidneys are located dorsally. Kidneys are located in in back of the body. That's why they are dorsal. Ventrally. Ventrally we have urinary bladder. Like that. I hope everything is done. We have some more terminology here for that. Proximal distal. This is proximal, this is distal. Medial lateral, towards the midline is medial, towards the midline of the body is medial, lateral, away from the body is lateral. Proximal means towards the head is known as proximal, distal means away from the head. For example, if it's on hand, this is distal, this is proximal. Proximal, this is distal, and if it is on foot, will be distal, this will be proximal. Thigh will be proximal, foot will be distal. Here wrist will be distal, shoulder will be proximal. Like that, towards the body, the nearest structure towards the body, it is proximal. The structure which is away from the proximal towards the head, which is proximal, the structure which is away from the head is distal. And I hope everything is done.